Hi, Patrick Pucabal here. A quick disclaimer, this video is entirely based off my own thoughts and my personal observation. This does not reflect with the company and the program I'm currently working. A week ago, while I was browsing my Facebook, my attention was drawn into something. Another frontliner died as a result of COVID-19. But his story of how he died is a bit different from other patients who have been infected by coronavirus. While I was reading the news of his death, reality sank in my mind of a doomsday scenario. I thought this only happened in a movie, but it's becoming real and it's disturbing. It's unfortunate that another frontliner succumbed to COVID-19 while he was doing his job. He risked his life while assisting and helping the returning OFWs. When he got infected and was in critical condition, he was rejected from all hospitals that he was brought in. He was transported from private hospital to public hospital, from regional hospital in Bacolod to provincial hospital in Silay and to Cadiz District Hospital. And still, he was denied because all of the COVID wards in the public and private hospital in the province has already reached its full capacity. His condition deteriorated and sadly, he passed away. I grieve with the family and sending my condolences, and also to those families who had lost their loved one in this COVID-19 pandemic. His story shows that the virus does not choose whether how powerful you are, or you're allied with the government, or what kind of political color you are supporting. He was even denied in every hospital that he was brought in, even he was a frontliner. If it happens to him, it can also happen to you. If you really love your family and you will do everything to protect them, this is the time to think deeply and seriously about this pandemic. This time, we cannot afford to be sick or get infected by this dreadful disease. No hospital will admit you due to overflowing of patients. If you think that this new normal is still normal, then there is a problem with you. You need to reevaluate yourself and the current situation. The virus has caused death and misery all over the world, and our government official is struggling to control this pandemic. There is no better way to combat the pandemic but by being compliant with the World Health Organization directive to maintain personal hygiene. Also, to strictly adhere by the national government directive for safety and orderliness of the community. The Philippine government are trying its best to handle the situation and has taken some of the most hardline measures in the world to contain the spread of the coronavirus. A few days ago, the provincial government of Negros Occidental and the Bacolod city government decided to have a one-time, big-time chorbalu. Chorbalu. Exactly, chorbalu. Whoever made the tagline, "Dawangwa sina raffle," I'm sorry to say that. And to continue, the province was put in a 4-day lockdown, which I believe it's not necessary anymore. It only added burden to the business owners and to our already crippled economy. Lockdown restrictions have no effects if people don't manage their own risk. With or without it, let's imbibe the culture of responsibility and discipline. And to quote that from Attorney Giselle Batapa. And I'm also going to share her top 5 reasons why you should stay home. I believe this is worth sharing. And number 1, number of COVID-19 cases are escalating the chains of transmissions and have not clearly identified at all fronts, except that the spike is said to be caused by OFW arrivals. So there is no clear way to base how individually manage your own risk, considering the lack of validated insights. Number 2, Bacolod has no functional real-time contact tracing system fully supported by contact tracing platform that has been cascaded for use down to individual level, so there is no clear way for you or your loved ones to immediately trace or be traced for exposure to positive patients. Number 3, our hospital have reached full capacity not only in terms of facilities but personnel and productive equipment, so there is no full assurance that you will be given hospital care and treatment if you have the money. Number 4, our health insurance guarantees are in shambles with huge unaccounted loss, and our local hospital still have huge pending claims with PhilHealth, so there is no clear assurance that the government will cover your expenses. Number 5, Bacolod do not have enough dedicated isolation facilities to ensure that those who are identified pre-asymptomatic, asymptomatic, or even symptomatic, as well as their close contacts, are able to quarantine for at least 14 days, so not to spread the virus. Therefore, there is no guarantee that when you contract COVID-19, even without symptoms, that you have a place to viably help you stay away for immediate family so as not to infect them during the virus culturable stage. Together, we can fight and end this pandemic. We Filipinos have been through a lot of hardships, trials, and disasters. I believe that we can live again a healthy and normal life.